Um, Thank you so much for joining us today. Gu Zhang will be introducing you, and yeah, thank you so much for making it. It's very exciting. Oh, I think you're muted.
Oh,
Yeah.
sorry, I'm a few minutes late. I never got the Zoom link.
No worries. I think maybe, Gu Zhang or I might have missed an email link or something.
Okay, but I'm here now.
It's great to have you here either way.
And then,
Yeah.
real quick, how long do you want me to talk for?
I think just depending on you, I think we'll try to make a few minutes for a Q&A, maybe like 10, 15 minutes. But it's largely up to you and just the nature of your talk, whether you want to give more room for people to ask questions or not.
So talk for like 10, 15 minutes?
Oh, no. I mean, like talk for like 30, 40 minutes and then Q&A.
Okay.
Mhm.
All right, great. Okay.
Hey, I just there's a little bit of weird feedback. I'm not sure if anyone else hears that, or Dr. Garfin I think it's from your stream, but
No, I don't hear it.
You don't hear it?
No.
I hear it.
It kind of like a low hum or buzzing sound.
Oh,
Here, let me try to log off and then come back on. Or there it's now, it's off.
Yeah, that's better. Thank you. Over.
Awesome. So, Gyoja?
Thank you all for attending this November SEAMH Symposium. So I am Jane, a volunteer from SEAMH, and SEAMH aims to bring together early career researchers, clinicians, and community leaders interested in mental health and psychosocial support in Southeast Asia. So great to have you here all today. And through this monthly symposium, so we hope to introduce you to addressing mental health and psychosocial support issues that may be relevant to you all, the people here today. So today we will have a presentation by Dr. Rose Garfin. So before we get started, I want to give you folks an overview of today's setting. So after the presentation by Dr. Garfin, we will have time for the Q&A. And so I ask that you keep your mic muted during the presentation. And in the Q&A part, so if you have questions, you can raise your hand using feature button, or you can write down your questions in the chat box. And so I'll start here. That means I will note down all your questions in the order received, and send it to Dr. Garfin, and she will answer those questions afterwards. And so be sure to keep your questions in mind as we go through this today's symposium. Without further ado, please allow me to introduce Dr. Garfin. Dr. Garfin is a community health sciences professor in the Fielding School of Public Health at UCLA. She's also a mindfulness-based stress reduction trainer, qualified through the UCSD Center for Mindfulness. Her academic work focuses on exploring how individual-level negative life events and collective trauma impact physical and mental health across the lifespan, and how community-based intervention can alleviate resulting health disparities, with a focus on integrative treatments. Her work has been funded by the National Science Foundation and National Institute of Health, and covered in hundreds of domestic and international media outlets. So please join me in welcoming Dr. Garfin. To you, Dr. Garfin.
Okay, hi, thank you so much. So it's great to be here today, and thanks to everyone for their interest in my work. So today what I'm going to do is I'm going to talk a little bit about mindfulness, stress, and particularly in the context of, because I think, is there a lot of students on this call or postdocs?
I think a few students, a number of people that have been practicing for a few years now, or a number of years.
Okay. All right, great. So, so I think what I'm going to do to start is talk about the mental and physical health effects of stress, and then I am going to talk a little bit about my recent clinical trial that was a mindfulness-based stress reduction for trauma-exposed homeless women. So let's see. And then I will Let's see. All right, can everybody see my screen? It's just a blank screen right now.
Yes.
Okay, all right. So over the past few years, it's really highlighted the critical relationship between stress and our physical and mental health. So, in the past week alone, if you've turned on your television or checked the news app on your phone, you were likely exposed to many different stressful events, including, hurricanes, the ongoing issues with COVID-19, even the election can be very stressful for people. So here's just over the past couple of years, some, really striking images, which, we know that there's going to be more image of this coming in the future. So this was like the Kabul airport, people fleeing, wildfires in California. We've seen many destructive hurricanes in Florida, and, COVID-19, which seems to be somewhat never ending. So pausing for a moment, you might recall or even now be experiencing feeling overwhelmed, sad, angry, indifferent, tired, anxious, depressed, or some combination of these emotions. Perhaps you feel stress in your body through the experience of tension, upset stomach, or neck or back pain. Research shows that these often initial responses are linked with both short and long-term negative effects on our health. And lastly, the effects of media-based and direct exposure to these large-scale events, like I mentioned on the previous slide, accumulates over time. So for this first part of the presentation, I'm going to present a small snapshot of my research that my colleagues and I have been doing on responses to stress and trauma. Then I'm going to provide an overview of how mindfulness can help downregulate the stress response and give some overview of a recent clinical trial that I've done on mindfulness, and then conclude with some specific tips on how to incorporate mindfulness into your life and your new normal in these unprecedented times that, now are just basically the new normal. So the acknowledgement that exposure to stress occurs on multiple levels is really important. So often we see this as a cascade of interrelated stress and trauma. So over the past decade, I've been working with colleagues at UC Irvine and now at UCLA to understand how exposure to these collective trauma impact our physical and mental health. And by collective trauma, I mean large-scale negative events that impact the populace broadly and can be experienced through both direct means and via the media. And our research has found that increased exposure to such events, both directly and via the media, portend more psychological distress over time. And these large-scale events are overlain with the stressful and traumatic individual level events that occur in our daily lives, both as a result of the larger societal effect and the causes and consequences of our own lives. So some research my colleagues and I are engaged in highlights this confluence of stress and their impact on our mental health. So this slide presents data from a nationally representative sample of more than 6,500 Americans. You can see here that key COVID-19 related secondary stressors, such as losing a job and canceling travel plans, personal experiences, such as I or someone close to me diagnosed with coronavirus, and media-based exposure was associated with increased acute stress and depressive symptoms. Work exposures were then negatively correlated with distress, perhaps the result of people being able to retain employment and leave the house during stay-at-home home orders during the early phase of the COVID-19 outbreak. And taken together, this highlights that stressors at each level of exposure can negatively impact our mental health. This graph highlights the specific relationship between COVID-19 related media exposure and traumatic stress responses, depicted here as acute stress. Our team found similar findings regarding media exposure and negative responses to the Boston Marathon bombings, hurricanes, earthquake, and the Ebola public health crisis. And I present this to emphasize that what is happening at the societal level is a key player in how we are responding to stress at the individual level, even if it is removed from our daily lives. And yet these large-scale events are happening in the context of our individual lives. So adverse events are common and include trauma, such as abuse, assault, serious accident, or suicide of a loved one, and stressful events such as divorce, illness, economic hardship, and bereavement. And unfortunately, nearly 94% of Americans report exposure to at least one adverse experience. And my research shows that these individual level negative life events that we experience, the more that the individual negative life that we experience make it harder for us to cope with collective trauma. So this slide shows data from a representative sample of Americans assessed after the Boston Marathon bombings. And these findings show that traumatic events that happened in childhood and adulthood, as well as recent trauma and recent stress, were associated with more post-traumatic stress following the Boston Marathon bombings. Red stars signify statistical significance. And this demonstrates the interrelationship with what happens over the course of our lives and with our responses to current stressors. And this is layered on top of the daily stress of work, family, social commitments, which are now happening under this uncertainty, this stress of, rising inflation, political turmoil, natural disasters, climate change, and so forth. And all of these stressors occur in three realities concurrently: the reality we're confronted with in real time, the reality of the past, and the reality of the future that hasn't even happened yet. And for each of the real or perceived stressors in the past, present, or future, our body and brain reacts the same. When we perceive a stressor, the body mobilizes to deal with it via the fight or flight response, which can be thought of as the body's gas pedal. There is activation of the sympathetic nervous system, increased flow of blood to skeletal muscles, increased heart rate, blood pressure, opening of airways, your pupils dilate, your eyes adjust. Repair processes are inhibited. And this is, really important when I think about this in the context of these collective stressors and, all this upheaval that we've been experiencing, because the body and our minds are not getting a chance to get back down to baseline. And we've seen this in so much data that is shown, particularly with young people, with youth and children, these just rates of anxiety and depression, which have doubled or more than doubled since 2020. We're not getting that time to come back to baseline. Under these states, there's a release of epinephrine and norepinephrine. And we have emotional changes such as negative affect, distress, emotions, fear, anger, and sadness. And those all serve to amplify these processes. As a result, no matter how we experience stress, it can set off a cascade of these emotional, physical, cognitive, and psychological processes. And while many of these processes develop for our survival when avoiding predators or dealing with immediate threats to our physical well-being, these resources are still critical even in the modern era. For example, we want to feel anxious enough about climate change that we do something about it. We want to be motivated enough with a threat of we have a lot of wildfires out here in California that, we're prepared for them or that we evacuate. So it's not that stress in a stressful situation is bad, it's adaptive. However, as this diagram shows, most of this is just happening automatically. We perceive a stressor, internal or external, collective or individual. The fight or flight response is activated, and we have a cascade of physical sensations, thoughts, emotions, and behaviors that we react accordingly to. Yet most of those reactions are out of habit, without much forethought. And this can lead to maladaptive coping, such as overeating, overdrinking, being short-tempered with friends and loved ones, or even avoiding the problem altogether. These are not helpful reactions. Most of the time, this is happening on autopilot. We're not in control, even if we want to be. We have all had the experiences of wanting to make a different choice in a situation, but not seemingly being able to, or reflecting on our behavior and being disappointed with how we handled it. By the time you realize what's happening, often you're already too deep in the activity, and it can seem like there's almost no momentum to stop it. This is called reacting, and it's done mostly out of habit. We can do our best to create the conditions for a lower stress life. We can leave early to avoid traffic. We can take the necessary precautions to prepare for a natural disaster. We can save money for a rainy day. But life is forever out of control, and we won't be able to prepare for everything. Mindfulness-based interventions can help break the stress reactivity cycle. So mindfulness is paying attention on purpose to the present moment, non-judgmentally. And this is from a quote from John Kabat-Zinn. He's a premier researcher of the benefits of mindfulness for our physical and mental health. This sounds simple, but often we don't do this. We react, we judge, we ignore, we dislike, and we may measure our experiences against our expectations of how we think they should be. We react to ourselves and others with a stream of criticism and commentary. Mindfulness helps us respond rather than react. And what does this mean? It means we have a chance to make a different choice about how to cope with a situation. This does not always mean that the situation will change. It helps us make a different choice and down-regulate the stress response, even during times of great difficulty. Often simply noticing the experience of stress in the body and mind can help reduce its negative impact on you. So just a few seconds, I'm going to do a quick demonstration. If you would like to participate, you can. If you don't, you can just listen along. It'll be pretty fast. But I just want everyone to sit in their chair or stand wherever they're at. Just stop for a moment. And notice whatever is going on in the body. So maybe close your eyes to zoom in. Just take 1 or 2 breaths. And notice what's going on in the mind, in the body. You may notice your thoughts racing. You may notice your heart racing. You may notice judging, labeling. This is stupid. I don't want to do this. I need to check my email. You may notice stress in the body, anxiety, sadness. Do a quick scan, and whatever process you notice, just hold your attention there. So if it's pain, anxiety, stress, racing thoughts, simply notice that without judgment. Thoughts racing, stress in the body, heartbreak. And notice that for many people, simply noticing that experience of stress can help reduce its impact on you. Even in those few seconds, people will often report feeling calmer, more present, less anxious. So these are things that you can do kind of throughout the day to check in and bring yourself back to a baseline. So what we just did helps activate the stress response cycle in terms of down-regulation. So mindfulness practices down-regulate the sympathetic nervous system response and activate the parasympathetic nervous system response, the body's rest and digest process. And what I really like about that quick little activity that we just did, sometimes meditation or mindfulness can seem overwhelming. I have to wake up early. I have to sit for a half an hour. I have to get a Calm app and do all these things. You can actually practice mindfulness in your daily life just by taking a pause, even not taking a pause. There's a lot of mindfulness practices that you can do washing the dishes. Just bring your attention to the feeling of the water on your hands, brushing your teeth. You can bring your attention to the experience of your toothbrush in your mouth, just simple things like that. And science has shown that simply bringing your attention to whatever you're doing can down-regulate the stress response. We become aware of what we're experiencing. And this brief pause can lead to an authentic experience of the present moment and the ability to decide how to respond accordingly as we go through our lives. Many times, this has even been the added result of reducing the problems that we're dealing with. For example, if we realize, when we're taking a moment to just calm down while we're washing the dishes or walking the dog, we might realize that we're upset about a situation with work, a social problem, some other current event, and we can avoid taking that out on a loved one, or try to actively refocus on work if it's something that we can change, or say, hey, like, I need to take some time for myself so I don't snap at someone. And again, just noticing like I'm on edge can help reduce the negative behaviors that stress can cause. So this has the added benefit of facilitating more positive relationships and greater productivity. So the term mindfulness, it gets thrown around a lot. So I do think it's important to emphasize what mindfulness is and is not, and particularly in light of the findings that I'm going to show you about my clinical trial, because mindfulness is not pretending everything's okay. It is seeing clearly and being present with reality as it unfolds, as it is. It is not pretending everything's okay. It is not being happy 100% of the time. It is not the absence of negative emotion. It's not a stress-free existence or the lack of thoughts, right? So even in that brief activity, one of the cues that I gave was just be aware of your thoughts. Sometimes noticing I'm having negative thinking, that can take the power out of it, right? So you can notice, hey, I'm having negative thinking, be aware of those thoughts, and then kind of reality test it. Like, that's not true. I'm not going to lose my job because I'm late with one assignment, or because I don't get one grant, or because my paper gets rejected from a journal. Those are thoughts that, can feel so true when we're having them, but just by noticing that it's simply negative thinking, it can take the power out of it. It's not denial. So, trying to talk yourself out of a situation you're upset about or a problem that you're having, it doesn't allow for you to see clearly what the problem is and how to figure out a solution. Sometimes the solution is just acceptance. Mindfulness is the act of being fully present with what is. And in doing that, we can begin to make choices that are more skillful and adaptive. And I truly believe that these practices have the power to even help people cope with some of the greatest difficulties. And that's why in my empirical research the past few years, I've been exploring the benefit of a mindfulness-based intervention in a sample of trauma-exposed unhoused women. So again, mindfulness is not going to take away their need for job training. It's not going to take away their need to find housing, but it can help provide skills that will make it potentially easier for people to capitalize on their own strengths, not to minimize, not to say everything's going to be okay if you sit in a park and breathe, but to provide some new coping skills to establish a better relationship with oneself, more self-confidence, more self-efficacy, so people can begin to make choices that will serve them in their recovery. So trauma exposure or post-traumatic stress disorder is a major public health concern. And in fact, it's a leading cause of disability and social and occupational impairment. Cross-national prevalence of PTSD is estimated between 3.9 and 8%. So that means between 1 to 2 out of every 20 people that could meet diagnostic criteria for post-traumatic stress disorder. It's highly correlated with depression and substance use. And these comorbidities are reinforcing, leading to a cycle of chronic mental health maladies. And when we're thinking about, trauma-exposed unhoused women, there's high comorbidity with substance use and PTSD. And a lot of the science shows that it's the self-medication hypothesis. So that's been very strongly supported by empirical evidence. So basically, for a long time, it was like, is it the chicken or the egg? So does using substances cause PTSD, or are people using substances to cope with their PTSD? And in fact, there's a lot of evidence that it is the latter. So people will use substances to manage their trauma-related symptoms. However, activities that are involved in using and obtaining substances will put people in high-risk situations where new traumas can occur. PTSD is often untreated in disadvantaged populations. So PTSD can cost over $19,000 annually to treat. Over 65% of those with PTSD do not receive treatment. And in fact, 12 years is the average time from symptom onset to treatment. So the cycle of trauma, substance use, incarceration, homelessness, and trauma, these are all important to address to really promote recovery in the most marginalized people in our society. And unhoused women in particular are at high risk for trauma exposure and PTSD. So as a result of these facts and figures, I think it really highlights the need for low-cost complementary treatments to address PTSD in populations with high health disparities, such as unhoused people. So again, mindfulness, it's the process of focusing one's attentions on the present moment without judgment, like we did with the little activity. And it's relatively low cost. So for example, just to give a quick example, even if you were going to get a highly trained clinical psychologist to teach mindfulness-based stress reduction, which is really like the gold star, it costs about, in California at least, depending, I'd say, to get the best trainer, between $4,000 and $5,000 for a 9-session course. But you could have over 20 people in that course. So, when you kind of reduce it down to the cost per person, it can be only like a couple $100 per person to get this really high quality intervention, delivered to them. So it can be, to me, really impactful for a relatively low cost. And there's a lot of research right now that's saying, can this be delivered by lay individuals? Can this be delivered via an app? And, those findings can also, increase its reach, feasibility. And these have demonstrated the potential feasibility and acceptability in marginalized groups such as unhoused women. So bringing it back to the kind of overview from the beginning of the talk, mindfulness-based interventions like mindfulness-based stress reduction may be particularly helpful for PTSD as they address some of the key psychological symptoms of PTSD, such as hyperarousal and negative cognitions, as well as the physiological symptoms linked with the inflammatory stress response that may presage the development of PTSD and resulting health disparities. So when we're kind of talking about being on automatic, there's evidence that that activation of the sympathetic nervous system comes before the experience of PTSD symptomatology that would be diagnosed. So to me, that really highlights the link between this kind of involuntary activation and mental health ailments. However, relatively few clinical trials on mindfulness-based stress reduction and PTSD have been conducted, and none with homeless women. And my student and I recently submitted a systematic review of systematic reviews that looked at mindfulness-based interventions for PTSD. And there have been a ton of these reviews that have been conducted. And there's actually been quite a few studies. However, most of the studies have been relatively low quality. They've been, had a lot of methodological problems. But the few that have been conducted that are really good, have pretty strong evidence. So, I think that speaks to the point that we need more research in the field, and particularly with, implementation, feasibility, and, what populations could benefit from this. So mindfulness-based stress reductions can help reduce PTSD and related comorbidities. So again, this research has exploded in recent years, but many methodological challenges and inconsistencies have led to mixed inferences regarding efficacy. And systematic review of reviews found medium effect sizes for mindfulness-based interventions for PTSD, similar to other second-line treatments like medication management. And mindfulness-based interventions can be conducted in groups, as I said, and it may be beneficial for those not wanting to discuss traumatic events due to stigma. So I mentioned mindfulness-based stress reduction. This is by John Kabat-Zinn. He designed this at a University of Amherst, and it was initially applied to patients with chronic pain and cancer. So these are people who are like at the end of the road of what they can do in terms of treating their symptoms. So it's a manualized mindfulness-based intervention. So, I mean, that's why I think a lot of people study MBSR. It's a booklet. It's got activities that you do by session. So, you know, there's a problem in the mindfulness and kind of yoga intervention literature where there's so much inconsistency with the protocols that are used that it can be hard to compare between studies. It's typically 9 sessions over 2 months, and people meet once per week with a 1-day mini retreat during week 7. And it incorporates body scans, meditations, gentle yoga, and homework activities include documenting pleasant and unpleasant experiences. So again, this isn't even like a breathing activity. Sometimes just labeling and noticing an activity can take the power out of this. Like, this is an uncomfortable conversation. And then once you can label something as uncomfortable, for example, then you may be less likely to react to it. You're just like, this is uncomfortable. I just have to kind of sit through it, you know, and maybe less likely to react. So the present study that I've been working on, and there's some preliminary results from, it asked the question, does mindfulness-based stress reduction reduce post-traumatic stress disorder, depression, and anxiety compared to a health promotion attention control? So this was an open label parallel randomized cluster clinical trial of MBSR to alleviate post-traumatic stress disorder, which was our primary outcome, and secondary outcomes, which were depression and anxiety. Women were enrolled in cohorts of 12 people per class. And although I said earlier that you can do them in bigger groups, this was a study that was done during deep COVID. So this started in 2020. And because of the population, I really felt that it was not feasible to switch this to an app-based program. So we did it in person. We worked with the state guidelines. We had social distancing, and it was capped at 12 people so that we could accommodate those COVID mitigation strategies. Eligibility criteria, people were 18 to 64, English speaking. They had clinically significant post-traumatic stress disorder as determined by standard guidelines. They had self-reported experienced homelessness in the past 6 months. And the inclusion criteria was that they were, they had to speak English, and they had to, they couldn't be cognitively impaired. All right, so the study setting, we did this with, conducted this study with Prototypes, which is a program of Health Right 360, which is under the California Endowment, which is a huge organization that does a lot to help the most marginalized individuals in California. So we were really lucky to have this great community partner who was really, helpful in facilitating the success of the project, even during COVID. And we also developed this we modified this MBSR intervention using a community participatory approach. So working with Health Right 360, we formed a community advisory board that included individuals from the community, from the sites, and we developed a semi-structured interview guide. Then we used 4 focus groups where we presented the intervention to people and we got feedback from them. We then did qualitative content analysis, and then we made some minor adjustments to the MBSR. And it was interesting because I really thought there was going to be more modifications, but it had a very high acceptability, very high feasibility. We've published a paper in Stress and Help, and then we have another paper that is hopefully coming out soon that really talks about this component of the trial and how women perceive the intervention and their feedback on it. So we had a attention control group, which I can talk a lot about that during the Q&A, but it was a health promotion class that was our control group, but it was an attention control, so it was an active intervention. And it included goal setting, envisioning health through heart, envisioning health through art, information on chronic disease management, nutrition and hydration, skincare, oral health, and promoting social integration and course graduation. And we'll kind of circle back to this at the end, but some of these skills are very similar to some of the skills that you would be learning in a mindfulness-based intervention. So here's an overview of the study. We did a pre-assessment with an eligibility screen, and then we took baseline psychosocial questionnaires. We also took physiological data, but that has not been analyzed yet, so I'm not presenting it, but we are exploring the link between mindfulness, post-traumatic stress disorder, depression, anxiety, and markers of the sympathetic nervous system response. Participants then were either assigned to be in the mindfulness-based stress reduction course or the health promotion control. And then after that, they were reassessed with their psychosocial questionnaires, their post-traumatic stress disorder diagnosis, and then we followed them again 6 months later, which again, that was a journey to find these people in the community, people with unstable housing, a lot of trauma, a lot of addiction. So we tracked them down 6 months later and followed them, but that data is still being collected as we're on the final cohort. So the data that I'm going to be presenting today is on these, the first 3 arrows. So in our study, we had 192 women that were screened and 157 enrolled in the study. So there was a lot of interest in this study. And we had a wait list that was running the entire time. So I think that speaks to the fact that the women that were in it really enjoyed being in it and were getting something out of it, just kind of even at that qualitative level. We had a demographically diverse sample of unhoused women. So it was mostly, minority, highly Hispanic and Latinx, Black. We did have, white people as well. So it was a very diverse group of people. And again, I think that this speaks to the response to the intervention. Attendance and completion was relatively high. So again, I think it's important to take this in the context of the ongoing COVID-19 pandemic, because we couldn't bring people back to the site because of COVID quarantines. Some of them were in sober living. We couldn't go to the sober living. So it was a pretty, challenging time. And even so, most of the women completed the study. So, I mean, to me, that was very encouraging. And there was no differences between groups with the health promotion control or the mindfulness-based intervention. So kind of connecting this to some of the data that I presented earlier in this talk, the women experienced many adverse childhood experiences. So some of these statistics, even when I was doing the study, were just absolutely shocking to me. Over 60% had been verbally abused. Almost 60% had physical harm. These are what happened to them as children and when they were under 18 living with their family. Caregiver too intoxicated to care for you. They lived with a problem drinker, were incarcerated. An adult was mentally ill. So, this kind of just really illustrates the fact that these women were set up to have incredible challenges. And, oh, sorry, I was, okay, hopefully. And these women also experienced many adverse experiences in adulthood. So again, almost 80% were physically attacked, almost 50% were raped. They'd experienced homicide of a loved one, suicide of a loved one. Almost 30% had witnessed a family member killed. So again, these are just like striking statistics. And almost 88% of them had been in jail and 29% had been in prison. So I think that this really speaks to, kind of a societal level problem of people being in this cycle of being, having trauma exposure, substance use. They end up in jail or institutionalized. They're released maybe to a treatment facility or back on the streets, and they kind of cycle through that again. So, it's really, really important to have interventions that can help break that cycle when people are released into the community. So to the results of the study. So the darker blue is the health promotion class, and the lighter kind of teal is the mindfulness-based stress reduction class. And you can see that both groups improved over time. So this was highly significant. The groups got a lot better, but the between group differences over time were not significant. So there wasn't that kind of interaction. both groups got a lot better. So that was with PTSD symptoms. Depression also improved a lot over time. Similarly, like highly significant differences between time 1 to time 2, but the interaction between group by time was not significant. Similar with anxiety. You can see this was really like most impactful with post-traumatic stress symptoms and the depression. And, kind of theoretically, sometimes people will report when they're doing mindfulness or they're kind of stop using substances, they will still report higher anxiety because they're more aware of the anxiety they were experiencing. So bringing your attention to it can also trigger a greater reporting of it sometimes. But even so, it was still highly significant improvement from time 2 from time 1. And again, the between group differences were not significant. And this led me also to think about, what are the mechanisms by which these improvements are happening? So mindfulness is a trait. It also has been demonstrated to change over time. So it's definitely not static. And again, we see that similar pattern of results. The mindfulness qualities improve from time 2, from time 1, and the between group differences were not significant. Same with self-compassion. So self-compassion is having feelings of love, kindness, and care towards oneself. And there's a lot of evidence that this can particularly be useful with people who have post-traumatic stress disorder and addiction. And similarly, we see this as highly significant, but the between group differences were not. So similar pattern of results. So could mindfulness and self-compassion be a key mechanism underlying improvement in PTSD and related outcomes? So the increased post-intervention compassion was associated with decreased PTSD symptoms, decreased depression, decreased anxiety, and increased post-intervention mindfulness was associated with decreased PTSD symptoms, decreased anxiety. So these could be mechanisms by which participation in these interventions, helped people. So discussion, PTSD, depression, and anxiety decreased over time. Self-compassion and mindfulness improved over time. Mindfulness-based stress reduction was acceptable and feasible to implement with unhoused women with PTSD and SUD, and there were no adverse effects that were found. So the health promotion group also improved. And, kind of just taking a step back, I've been involved in some other studies, and we found this with other groups when we're looking at psychological outcomes. So again, I think this kind of speaks to the link between that physical stress response and chronic health conditions and mental health. So it's so interrelated. I think that it's really important to take a holistic approach to trying to help folks. The health promotion group may also have increased intentional control, improved coping skills, emotion regulation. And there was also a lot of social support. So just kind of anecdotally, we had a little graduation ceremony for the women at the end of the interventions, and they would cry at the end of both of them. Even after the control group, they would be like, this was so impactful. This was so meaningful. Thank you for doing this. I learned so much. This was life-changing. And so, that was great to hear, although, kind of as a researcher, I was already thinking this, was probably not a true control group. It was an active intervention as well. And so it can be very difficult to find an appropriate comparator intervention, particularly with behavioral interventions like MBIs, because some of them are really targeting, the same symptoms and the same processes. So with my next study, I really want to compare it with treatment as usual, where they're not getting another active intervention, or test the additive effects. So you'd have 3 groups with like mindfulness-based intervention, a health promotion control, and then a health promotion control and the mindfulness-based intervention. All right, so some limitations: COVID-19 related factors limited intern validity. The groups were not randomized. There were some unequal groups and unequal time frame of intervention, administration, and assessments due to the COVID-19 pandemic. And there were also history effects due to COVID-19 pandemic. So like there were different kind of mitigation efforts. They were on lockdowns. They were sick. Their loved ones were sick. So, we were kind of doing this in this time of a lot of variability. So, for future directions, I want to test this MBSR using randomization in a post-COVID environment, compare MBSR with treatment as usual and/or MBSR plus health promotion to test additive effects, and explore the use of peer and environmental support to encourage practices in between classes. So, I was very doubtful that the women were doing a lot of the practices in between. We gave them little recorders, and I just think there was a lot of variability. Some of the women would come up and say, I love these meditations, I do them every day. And then, for other women, I think the adherence was lower. So trying to create more structural supports, I think could improve the effect sizes. All right, so what can we learn from this, and how can we use these processes to benefit our own lives? So one thing that can be good and works for me a lot is the stop method. So when you're starting to feel stressed out or anxious or reactive, stop. So the first letter is stop what you're doing. Just stop. Wherever you are, pull over to the side of the road, stand in the kitchen, call someone back, look away from the computer, stop what you're doing, take a pause. And again, this doesn't have to be a half an hour, 15 minutes, not even 5 minutes. Even a few seconds of mindfulness can improve that reactivity. Observe your thoughts, emotions, and body sensations. Even if it's just, I'm tired, I am anxious. This is bringing up something else that I've been upset about in the past. And just observing that, labeling it, noticing it can take some of the power out of it. And then proceed with that new knowledge of what's going on in yourself, in your mind, in your body, move forward. So again, the effect sizes and some of the data coming out about the uses of these apps, it just is so powerful. So, I'm a big believer that, social support in these group settings with mindfulness can be really helpful in increasing adherence. But, there's a lot of evidence that these apps are fantastic. You can do a body scan meditation in your home, car, or office. And, I'd recommend, there's a lot of free ones on these apps that I listed. And you can have them on your phone at any time. And they have a short ones, 5 minutes, 10 minutes. So again, I think it's important to realize that this kind of self-care and increasing your mindfulness doesn't have to be a huge time commitment. Even a few seconds or a few minutes of a day can be game-changing. Take a sense and savor walk on a lunch break. So what a sense and savor walk is rather than going on a walk and being on your phone or listening to a podcast, which I absolutely love to listen to podcasts on my walks, so it's not to never do that. But even just a few minutes on that walk, noticing the air, noticing the ground, the trees, the sunshine, and just bringing your attention to what is going on around you can really reduce that stress response for the rest of the day. As I talked about earlier, bring awareness to small daily activities. We can feel so busy. Again, it can feel daunting to cut out a half an hour every day for meditation. But by bringing awareness to small activities during the day, that can really increase the amount of time that you are living in that mindfulness and self-compassion, and can really improve your physical and mental health. And too, some people are overwhelmed because when they do meditation, sometimes all you're noticing is your thoughts. That is the practice. So when you're meditating and you're noticing your thoughts, every time that you come back and notice thoughts racing, thinking, worrying, negativity, fantasy, daydream, those are all moments of mindfulness. And that experience of coming back to the present moment is where the magic in mindfulness happens. All right, here are some, I'm gonna skip this. here's some other ideas. Integrating mindfulness into your new normal explores what works for you. You can do something like eat ice cream mindfully. Call a friend mindfully. Notice what you're saying on the phone. Be present with the story that they're telling you. I mean, so much of the time when we're talking, we're just thinking about what we're going to say next. And that's human nature. There's nothing wrong with that. But you could call a friend, ask them how they're doing, and then truly focus on what they're saying. And, it can be a way to be of service to your friend as well. Spend time in nature. Even watching a movie with your family or friends, sit on the couch, put your phone down, enjoy the movie or the show that's in front of you. Or even when you're binging a Netflix show, you can think, am I choosing to watch the next show? Or is this just an automatic process and I'm staying up all night and I need to get up for work? And both could be powerful. It can be powerful to say, I'm going to turn off the TV and go to bed. And that's a moment of mindfulness. Or, gosh, I had such a long day. I just really need some downtime and I'm going to watch another episode. So again, this doesn't have to be happening on a mountainside in India. I mean, I've been to meditation retreats in India and that's fantastic. It's amazing. And, go if you have the time, money, and inclination. But at the same time, bringing these moments of mindfulness into your daily life, I think can be just, if not more powerful, because they enhance your experience of your one precious human life. And so in conclusion, I want to circle back to using mindfulness to develop the capacity for peace, even during times of great difficulty. So this was from a project that I did during COVID-19 and that I talked about in the beginning of the talk. And this word cloud represents responses provided when we asked Americans to write in any positive benefits that they experienced as the result of the pandemic. And additional analyses indicated that finding positive benefits did not negate the negative aspects of the experience. So positive benefits and negative psychological mind states could co-occur. So it's not that mindfulness means everything's okay, but it highlights that the challenges in life and inner peace can coexist, which I think is important for us to acknowledge moving forward. And if we're able to bring more awareness to the present moment, we might better be able to see silver linings during times of difficulty, even if this doesn't necessarily mitigate the clouds. And again, we can see in the middle, time, family, home, learn, these are the things that, people took from these negative experiences. And I'd like to thank all my collaborators and thanks so much for you guys for listening.
Thank you so much. That was an amazing presentation.
There's a question from Dr. Thomas. He asked in the chat box that he's curious if you have any thoughts about why improved awareness is beneficial. And evolutionarily, it is easy to see why focus would be helpful. But what about introspection?
Yeah, wait, can you say that again? Introspection?
Yeah.
Okay.
Yeah.
Right. Yeah, that's really, really interesting. So could you clarify what you mean by introspection?
Yeah. Okay.
Yes, hi. Thanks for your talk. I'm just interested in, you mentioned near the beginning of your talk how stopping, and you did a little exercise with us, so stopping and being aware of breathing and the moment and so forth, and everyone reports that it helps. Why? Why does that happen? Why is awareness so powerful? Or even in a sort of logical way, how come that has evolved to be beneficial for humans? You don't have to sell me on it. I know this is true. I teach it myself. Yeah. But I've never quite understood why the awareness piece makes such a huge difference.
That's a great question. And I'll kind of bring it back. And I know I I tried to weave it through the talk today. I think a lot of that is because of that physiological response, right? So kind of like you were saying from an evolutionary perspective, we're thinking about the future. We're worried about what's going to happen. why we have a negative bias in our thinking, right? So humans are always going to the negative, and that's so that we can learn from danger, right? So that we can protect ourselves. We don't need that as much in the modern era, but it's still allowing us to activate in that state of like fear and danger. When we bring ourselves back to the present moment, I just think there's something physiologically that kicks in that you realize nothing's happening to me. I'm just sitting here in my house. I'm safe, And so I think that can kind of kick in the parasympathetic nervous system, where we have that kind of like repair processes, and just kind of like turns off those chemicals. I mean, those chemicals are so strong. I mean, I just had this crazy experience last week where like I was leaving for the airport. I dropped my wallet at the hotel, and I was like, I was panicked looking for it. And I had this experience of like, I can just feel these chemicals like in my body. Like, so yeah, it's interesting. All right. Other questions?
So there's a questions from Israel from Myanmar, and he or she want to ask verbally. So could Israel, can you turn on your mic? Yeah, thank you.
Yeah, thank you. I'm from Myanmar, and I may have some language difficulties. I will try my best to ask the question. Yeah, so I am a medical doctor, but I am going into the mental health field because I think that's where my passion is. And my question may be a little bit like awkward or out of the current topic, but sometimes I feel like I have been knowing about the mindfulness, and I also use it to give like mental support to my clients or to my patients, and it's really useful to use mindfulness for ourselves as well. But sometimes when we are so mindful, like we know like so well how to control our emotion. We really know how to be at the present. So, but sometimes I feel like that kind of make us lose the beauty of life, which is like a little bit of anxiety, a little bit of like how to say, like excitement, and how to say, like those fear, like because like in our life, we are so control of our life. There's no excitement. There's no like I don't know how to say, no sparks in life. So I also get that feeling like if we are like but like for people who are suffering from PTSD, like mindfulness is definitely like useful, and we need to use that. But like for like normal people or general people, I think that might, just to my thinking, like that might kind of make us lose what is the life is about. How do you get what I'm saying?
Yeah, I think I understand what you're saying, and I will challenge that perspective. So I really don't think being present takes away from life's excitement. If anything, it can enhance it. So, for example, I'm a downhill skier, or when you're downhill skiing, you don't want your mind somewhere else. You're not going to be able to go fast down that mountain. You're not going to be able to weave through that. You're going to hit a tree if your mind's somewhere else. So, if we think about, anyone that's like kind of played sports, or even like, we probably have a lot of academics, when you're finishing a grant or writing a paper, or like whatever you're doing that is like your passion. I mean, you're doing it with your whole heart and your whole mind and everything that you have. Another example is like getting married. You have all this time, you plan, if anyone has ever had a big wedding, you could spend the whole day worried about the flowers and the guests and the bridesmaids and, your, whatever it is, the food and, who, whatever's going on, who's got the ring, and miss this beautiful life milestone because you're so worried about what could happen or what happened, or that you're missing that sacred moment where you commit your life to the other person. You could be missing that whole thing because you're thinking about the past or the future. So, that's just one example, but I really do think that I think your point's very well taken, because I think that it's really been co-opted by a lot of new age practitioners, where mindfulness has kind of been synonymous with like checking out or being laid back or being chill. I don't think there's anything necessarily chill about being mindful. Like, for me, I want to be mindful so I can live my life, so I can be present with my friends, so I can focus on my work and achieve something, so for me, like, those two things are not incongruent, but I think that point is so well taken. And, there's a lot of research that's been critiqued, about, toxic positivity, which is basically like this kind of, oh, you should be happy all the time. It's like, no, you're not. Why would you be happy when someone you love passed away? It's a time of grief, but it's okay to be present with that grief. So I think that point is very well taken, and it's a big issue in the field. So thanks for bringing that up, but I absolutely don't think that being present is incongruent with experiencing excitement and joy and, adventure.
Thank you so much. So I think it's also we have to also like consider about the balance. And I also want to ask a little bit more, which is like, so can we be like too mindful? Like, is there like, I don't know how to overusage of mindfulness?
Yeah.
Everything has pros and cons.
Well,
Thank you.
I put on the slide, I even think there's time to like mindfully check out, sometimes maybe I'm just thinking from my own experience, my work is really demanding. Sometimes like on a Saturday afternoon, and it's like a beautiful day out. I live in Southern California, and I just think I want to lay on the couch with my significant other and just watch a movie and just be with this movie, And so I don't think that, it can be whatever you want, it's just making that choice. It's being in control of your choices, and sometimes that choice could be, I want to just watch movies, I want to read a book, I want to sleep in, I want to go to, so it's not always this like hyper focused, intense experience, but it's knowing like, I'm actually so activated and I'm so stressed out, I actually need a day off to just do whatever I want. And maybe that isn't something that, some new age person might think is like positive or mindful, but, to me, like, we're not all new age gurus. Like, we have busy lives, we got like a lot going on. And so I think that it's just, again, is binge watching Netflix when you have a grant due a good idea? Probably not. But maybe the weekend after that, you want to do something more relaxing, I think that, you can mindfully check out, if that makes any sense.
Yeah, thank you so much for Israel for his questions. For the sake of time,
great question. It's such a good question. I think I could talk on that. I have a lot of thoughts about that. So yeah, great questions. Obviously.
Yeah, it would be great if maybe this conversation could also continue offline as well. But for the sake of time, I wanted just to transition to So Van Rieth's question. So Van Rieth, did you want to unmute and ask your question, or should I just read the question aloud?
So Van Rieth, don't know if you're still there. You had a question about mindfulness-based modalities such as MCBT, mindful breathing. Would you like to ask, or you just want us to read it?
I think you just want it read out loud.
Okay,
So,
all right.
So does MBTI mentioned here refer only to MBSR, or also to any other mindfulness-based modalities such as MICBT, mindfulness breathing, etc.?
Great question. And in the systematic review that I referenced, that was a big conversation. What we were going to include, what we were going to determine as mindfulness. Ultimately with that, we kind of focused on things that was really like that experience of bringing the mind to the present moment was important. I mean, some mindfulness trials will even use like relaxation as the control group. So I really do think that some of those things, maybe like they could be the same, but the intentionality or like even the instruction could be different. And that's what really will kind of like differentiate that. I love like DBT with mindfulness, cognitive-based therapy with mindfulness. I mean, the evidence is just so compelling that, I mean, those can just create such meaningful changes in people's lives. So yeah, great question. I don't know if that answered your question, but it's just a great field of research.
So just for the sake of time, I think we'll probably just end on to 2 questions. So one from Solinet, and then another one from May Honey. So Solinet had a question that was, let's see, to ask whether for your thoughts on MBTI MBI implementation with patients/clients struggling with somatic symptoms or those diagnosed with somatoform disorders.
Yeah, so that's a great question too. You know, just that honestly is probably a little bit outside my area of expertise. I'm not an expert in somatoform disorder, and I'm not as familiar with the research on that topic. So, I mean, I think that, you know, I just don't want to answer incorrectly because I'm not as familiar with the science that's been done on that. I would think that anything that can bring the attention to help with a reality check can be really helpful. But I know what you're saying, because people with these kind of somatoform disorders, I mean, they are experiencing those symptoms just as if they had like a biological, you know, etiological beginning. But I'm not as familiar with the relationship between mindfulness and somatoform disorders, but that's a great question.
Awesome. And last question from May Honey. Could you unmute and ask?
Hello, hi there.
Hi.
In my experience, asking from Myanmar, by the way. In my experience, you know, I felt like in my personal journey, self-judgment and criticism has just been in the way of mindfulness, have been in the way. And it was only very recently that I was able to overcome that barrier. And I just wanted to know your thoughts on this, because personally, I have felt like self-judgment and criticism has been a very significant barrier towards mindfulness. So any thoughts?
Great question. And I actually just submitted a grant on this topic like 2 weeks ago. So I don't know if you're familiar with mindful self-compassion, but it's a really cool intervention. It was developed by Kristen Neff and Chris Gerber. There's been research on it more and more recently, and it came out of that exact experience that people were reporting that. And so it doesn't just have roots there. So there has been kind of in the tradition of mindfulness and, you know, Eastern traditions, this one of the most, and the science on this has been around for a while, that kind of like a loving kindness meditation is actually one of the most impactful meditations with improving outcomes. So self-compassion kind of takes that and combines it with mindfulness, and it really encourages, it has practices that use the tools of mindfulness, but really focus on encouraging self-acceptance, lowering self-judgment, lowering self-criticism, and truly gaining skills to have greater self-compassion, self-love, you know, so that we can support ourselves in being who we want to be in the world, accepting who we are. I mean, we all have different strengths and weaknesses, and each of us, you know, has, you know, a unique contribution and deserves a life of meaning and purpose. So I think that some of those self-compassion exercises can allow people to really access that internally, because there's so much that is input by the media and, you know, society that brings us down. I mean, I could go on a soapbox about that, but, you know, we're designed with that sense of criticism so that people can sell us things in the hopes that we will feel better. And now that is so ingrained in so many of our psyches that, you know, we need skills to kind of get out of that. So great. I would look up mindful self-compassion. There's classes online, there's meditations online. So if there's not one that's offered in your area, like, you can definitely access those practices, and I think you might really enjoy it.
Okay, thank you for sharing.
Thanks so much for being here, everybody.
Yeah,
This
thank you
was
so
fun.
much. Yeah, thank you.
Dr. Chang, can I also just make a quick announcement about the next symposium before we?
Oh, yeah, sure. Mhm.
Okay, great. Well, thank you so much for joining us today. And thank you so much to Dr. Garfin for your really fascinating presentation. I wish I had time to ask all the questions that I have too, but we're short on time today and I wanted to let other people go first. And I just wanted to say that this is our first of the monthly symposia, and our next symposium is going to be December 15th. So stay tuned for information coming about that. And that's going to be with Dr. Elizabeth Durham, who is an anthropologist at the University of Michigan, who studies global mental health and also psychiatry, especially in Cameroon.
Thank you so much, Dr. Leslie, and thank you again to Dr. Garfin for such a fascinating presentation. I see that Dr. Garfin has shared her email address in the chat, and so if anyone has remaining questions, please do email, and I think we'll share it too with those who had RSVP'd. It is a little bit, unfortunately, late in Southeast Asia, but we had over 80 people RSVP, so I think people will be so fascinated by the recording and we'll have a lot of questions.
This is a great turnout. I mean, if you guys have, I think they usually say about, this is probably about on par. So getting 80 people or 20 people on a Zoom. I mean, that's, you guys did great. Congratulations. You guys had a great turnout.
Thank you.
Yeah, especially considering the time in Southeast Asia.
Yeah, I thought this is a great turnout, guys. And this is just the beginning. So I'm sure you guys will build it up from here. So congratulations.
Yeah, very exciting. So just before we close, I did want to take just a picture of the group. So for those who are willing and interested, even though it's midnight in Southeast Asia, willing to turn on their camera, please do so. And those who are not, it's perfectly fine as well. So I'll just give folks maybe 10, 15 seconds to decide what they want to do, and we'll just take a photo. All right. All right, so let's take a group photo. 1, 2, 1, 2, 3. Awesome. Thank you so much, everyone. And thank you again, Dr.
Bye. Thanks for having me.
Yes, thanks so much.
Okay,
Thank you, everyone. Hoping to see everyone again next time.
bye.
Bye.